Catching whooping cough early prevents long hospital stays. Once diagnosed, treatment begins quickly. The mainstay is antibiotics, usually from a macrolide group, like azithromycin, clarithromycin, or erythromycin. Antibiotics work best if given early in the illness, as they reduce the severity of symptoms and prevent spreading the infection to others. For infants, who are at the highest risk, hospitalization may be necessary. There, babies can receive oxygen therapy to help with breathing, intravenous fluids if they're unable to feed properly, careful monitoring for dangerous complications like pneumonia or seizures. Adults and teens often recover at home, but supportive care, rest, fluids, and managing coughing fits remains essential. Early diagnosis doesn't just save lives, it also protects communities.